The fight against COVID-19 is, of course, something that changes day by day. And to keep us up to speed, we bring in Dr. Anthony Fauci, Chief Medical Advisor to the President and Director of the National Institute of Allergy and Infectious Disease. Dr. Fauci, once again, thank you so much for your time and joining us tonight.
My pleasure. It's good to be with you.
So we know that new guidance from the CDC is in the works, including mask wearing. It could come as early as next week. What might that guidance look like?
Well, I mean, I don't want to get ahead of what the CDC will be doing, but I think the suggestion that Dr. Walensky had given, that they will be changing some of the metrics that guide the recommendations for masking across the board. I mean, right now, if you look at the recommendations are related almost exclusively to the number of infections per 100,000 in the map that the CDC puts out, where if you look at the color code where red and orange are situations where you have higher substantial amount of transmission and infection as determined by cases, I believe it likely will be much more looking towards things like severity of the disease and hospitalization, so that there can be a situation where if you have regions, states, and cities that have a lower level of these, what we figure are really much more meaningful in the sense of the severity of the disease as represented by things like hospitalization, that the mask recommendations will likely take that much more into account than they currently do.
What we have been seeing is a number of governors, or in the case of D.C., the mayor, who have had to make independent decisions about dropping mandates. Why haven't we seen the CDC or the White House get out in front of this and provide guidance or criteria for mandate roadblocks before now?
Well, I mean, I think the CDC has been given recommendations based on the dynamics of the outbreak, and people feel, and I think appropriately so, that they would like some more specific metrics, because we're starting to see, as the number of cases and the number of hospitalizations diminish.
Are you concerned about the Omicron subvariant?
Well, we always take all variants seriously. If you look at the subvariant, which is referred to as BA2, it is at a very low level in this country. It's somewhere between 4 and 5%. It's been with us for a while. It doesn't seem to be escalating in the sense of its doubling time, where it's not taking over from the original Omicron, which is BA1. But of course, as with all variants, we always pay close attention to it.
This is a bit of a crystal ball question, but I am curious if there's any evidence out there that you've seen that makes you think that it's more likely that we will see a variant that's stronger than Omicron.
You absolutely, Lindsay, cannot make any prediction like that. I mean, there's no formula to be able to say the next variant, if we have one, which almost certainly there will be variants as long as there's a high degree of dynamics. It really is virtually impossible to predict what that variant will be. And that's the reason why the best thing that we can do, and we say it over and over, but it's very true, to get as many people vaccinated as we possibly can and boosted when the time comes up. And the reason I say that is that if you look at the evolution of the variants, remember, we started off with what we call the original strain, the ancestral strain, and we made the vaccine against that strain. And yet boosting with the original vaccine has done very well, at least in protection against severe disease, which is a very important parameter. So not knowing what the next variant is, we're preparing simultaneously with being able to improve on our current response.
And you just mentioned the importance of boosting. Is it your expectation that at some point in the near future, a fourth shot will be recommended?
Well, what we're following very closely in real time is what the durability of protection against hospitalization. The latest data that came out showed that a booster, a third shot against Omicron, namely in the Omicron era, a booster can actually keep at 4 to 5 months the protection against hospitalization at about 78%. We're following that in real time. If that diminishes substantially in the durability of protection against severe disease, obviously you would seriously consider moving ahead with a booster on a more general way.
One major battleground in the fight over masking, as you well know, is classrooms. As we've reported on in San Francisco, tensions boiling so high that there was a recall vote for 3 school board members who parents thought were focusing more on social issues and less on a return to normalcy for kids. Let's take a listen.
The kids had only about 6 weeks of in-class instruction last year, before summer break. So that is a huge loss when it comes to kids who are coming from difficult socioeconomic situations.
Just a very direct question here. Should children be wearing masks at school?
Well, right now, according to the metrics that the CDC has currently in place, the answer to that is yes. And the CDC does recommend that there's masking in school, given the current dynamics of the outbreak right now. When they are doing what you suggested earlier on in the interview, that they're looking at modifying the metrics of what they consider the guidelines for masking, that could change in some regions depending upon what the level of viral activity, as well as the impact on severe disease as manifested by hospitalization.
And let's talk about vaccinating children. According to a new study from the CDC, hospitalization rates for children and teens were 4 times higher during the Omicron surge than Delta. For children under the age of 5 who are ineligible for vaccination, it's about 5 times higher than that. And many parents are, of course, wondering what needs to happen in order to get a vaccine cleared for that younger age group.
Well, what needs to happen is that the data that are being collected right now will be evaluated. Pfizer has said that they are going to, sometime in early April, submit the data from their 3-dose regimen. Everyone wants to get vaccines available for children in that young cohort from 6 months to 4+ years, leading up to 5 years. The original regimen of the trial was a 2-dose regimen. That clearly did not reach the area of the specifications of being available in the sense of highly protective. And that's the reason why it likely will turn out to be a 3-dose vaccine. And those data are being collected right now.
And right now, just a little more than a quarter of children between the ages of 5 to 11 are actually vaccinated. What do you say still to parents who remain hesitant about getting their children vaccinated?
Well, I think you just have to look at the data. And the CDC actually came out with a hospitalization data in children, I think just today, I think it was 1 o'clock, their MMWR came out. Although, yes, it is true that in general, the disease is not as severe in young children as it is in certain adults, particularly the elderly. We urge parents, certainly now that we have the vaccine available for children from 5 to 11, to get those children vaccinated. The percentage of children that are vaccinated in the age cohort is too low. We've got to do better than that. We've got to protect the children.
And this, again, a little bit of a crystal ball question, but as far as travel is concerned, at the pace the cases are declining right now, what do you think that summer travel might look like?
Well, I hope, predictions are very, very fraught with difficulty because we've been sort of bitten by that in the past. But what we're hoping for is the best case scenario, that if we continue to get a diminution in cases at the rate that it's going down right now, and we don't get hit with another variant, and again, that's unpredictable. We hope that best case scenario will play out as opposed to a worst case scenario, which would mean we're going to get another variant. But I would hope that there'll be a lot of relaxation on restrictions. People will be able to travel much more freely and feel safe about traveling. That's what we hope happens as we get into the months ahead.
And in those months ahead, our country right now, at least, is still seeing about 147,000 new cases of COVID per day. But what would that threshold be in the future for you to say, OK, the pandemic has passed?
There's no magic number, but what you want is to make sure the trajectory keeps going down and down and down. And I think the important issue, and that relates to one of the questions you asked before about the CDC considering giving more precise metrics for decision making, that concentrating more on what the rate of severe disease and hospitalization is will determine that. We don't know what that number is yet, but that will be much more of a determinant than the rate of infection.
And lastly, Doctor, you are one of the longest serving employees in the federal government. You've said that you will not step down until COVID is in the rearview mirror. We might be dealing with this for years. If we are able to move into an endemic stage, might you then think about retiring?
Well, I certainly have to retire sometime. Either that or somebody's going to fold me flat on my face on my desk. So the answer is yes, I will retire sometime. I promise you that.
Dr. Anthony Fauci, thank you so much, as always, for your time.
My pleasure. Good to be with you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.